So this is part 2 of the video, and now let's talk about opportunities in various private enterprises for a fresh BDS graduate. First, you can start working as a clinician, as an associate dentist in a clinic. Now your salary here will really depend on which tier city you are in. If you are say in a tier 2 or a tier 3 city, it can be as low as 10,000, can go as high as 30 to 40,000. But again, if you are a fresh BDS graduate, please expect somewhere around 10 to 20,000. Now this changes substantially if it is a tier 1 city, where your earnings can start from 25,000 and go up till 50,000. Now let's talk about the pros. The first thing is that in our colleges we learn very older redundant practices. So working in a clinic will give you the first exposure, where you'll be exposed to doing RCTs. You'll see how a clinic runs like, and if your mentor is good, you can learn a lot. Now the cons are that your working hours will be very grueling. Your take home salary will not be much, specifically if you'll be comparing yourself to your engineering counterparts. Please don't do so. Dentistry is a marathon, and since you have committed to it, you are passionate to the skill, please be patient. You have to keep this in mind. Other than that, it can become exploitative too at times. So please be very clear about what type of clinic you want to join and what type of clinical practices you want to incorporate in your own skills. Now, the second which options you have are corporate dental chains, for example, Clove and Apollo. So generally they are present only in tier 1 cities, but you will be earning much better. That is, you will have a take home salary of close to 25,000, which can go high till 50,000 with incentives. Now the pros are that you will be following standardized protocols. You will be exposed to how marketing and management also looks like beyond dentistry, and you will have a clear growth ladder with a competitive edge. Now for the cons. So it is going to be a very sales driven organization. Your weekends will definitely go for a bunt because you will be expected to work during the weekends. Other than that, you may have to transfer between clinics. That is, you may have to go from clinic 1 to clinic 2 within an entire city, and your schedules will be tight. Again, you will have to really give your heart and soul out for this. The third is your own private practice. So yes, initially this will take time. You may feel that your payment is very erratic. You will have to paying your staff. You'll also have to pay a rent. So it might be slightly disturbing in the initial years. You may feel that you didn't get your mehnat's worth, if you will, but again, just remain consistent. This really goes up beyond 3 years or so. Once you establish your name, once you are very skilled, the patients will come to you. So keep the faith in this one, and once it grows, then there is no stop to this boom. You will do very, very well than those people who are in a clear-cut jobs. So yes, the cons are that initial uncertainty will be there. Times will definitely test you, but once it pays off, once you are through that plateau phase, happiness is going to be there in the horizon. But I will definitely suggest that for a fresh BDS graduate, I won't suggest that you should just rush into opening your own private clinic unless you have high confidence in your own skill set. It is better that you work under someone, you learn the new marketing techniques, you learn the nuances, you learn the advancements, because there are certain things which no college teaches us, which we all know very well. Other than that, a fourth option which many students go for is to prepare for NEET MDS exams, where they want to clear a government college. So the thing is, I will never suggest that you should take an entire drop. There is some terminology which I use called as a partial drop. So in this, just try to join some clinic and then again put grueling hours of studying every day. So the thing is that if you will join a clinic, your skill set won't be lost. You will be in touch with what is going on. You'll definitely be making progress. The cons is that yes, you may have to be monetarily dependent on your support system, on your parents. You can't expect very high salaries. But again, you will remain consistent. And if you are planning to take this partial drop or a drop for NEET MDS, please ensure that you are going all the way, because even doing a PG in a government college does not give you a guarantee for a job. It is again that question of what now will come after 3 years. So you have to remain consistent, ensure that you are building up your skill set, ensuring that you are really learning the way things you should. So wishing you the very best. These are various private options. For more such details, for more such discussions, Follow Dental Desk Academy. Thank you so much. Jai Hind.